working to assist homeless veterans. I'm Jill Horner. This is Comcast Newsmakers. With me is Harry Marmorstein. He is with the Drenk Center. Thanks for being with us.
It's my pleasure.
First of all, let's talk a little bit about the Drenk Center, because you are the Community Mental Health Center for Burlington County.
Yes, we were founded in 1955 by Judge Lester Drenk. It was actually the Burlington Memorial Guidance Center in those days. It was renamed in his honor after his passing. It started basically providing services to adolescents who were coming before the court, and now we serve 8,000 people in Burlington County and across the state in a lot of different areas. We provide the screening crisis intervention services for Burlington County. So if someone's in imminent danger of harming themselves, someone else, or property, our screeners can craft an intervention that may be helpful for those individuals. We also provide residential care for the Department of Children and Families. 132 kids are in our care every day, and our ambulatory outpatient department serves outpatient services, prevention services, and case management. And that's really what we'll talk about more today.
Now, when we talk about case management and the other services that you work to provide, you have a focus on veterans as well. Let's focus on what you do there, including supportive housing. What does supportive housing include, and what does that mean specifically when it comes to veterans?
Well, supportive housing, we help about 120 people every day live and thrive in our local communities. They have seriously persistent mental illness, and they need case management to help people make sure that they're getting to their doctor's appointments, they're getting their food, and they're taking care of all the things they need to, potentially volunteer, go to school, even work in the communities. So our case managers go out and meet with individuals on a regular basis, sometimes every day, sometimes once or twice a week, depending upon how much need an individual has. Many of those individuals are veterans, and our Project to Assist the Homeless, or PATH, about 18 months ago received a enhanced funding from the federal government to focus primarily on veterans who are homeless. And that's really been a focus of our PATH project.
How big of an issue is it when we are talking about homeless veterans, and what are some of the struggles that these individuals face on a daily basis?
Well, in 2011, we served about 67 homeless individuals. 32 of those were veterans who were living in woods, in motels, in all kinds of locations throughout Burlington County. It's really a huge problem. Most of our veterans that we're serving who are homeless are under 40. Most are male. Most are from the Operation Iraqi Freedom or Operation Enduring Freedom. We have a few from Vietnam still who are homeless and that we're assisting. The biggest barrier for our veterans is getting connected to the veteran service itself. In our area, you have to go to Philadelphia for a veteran to become eligible to receive the benefits. I have to say, once they get connected to the Veterans Administration in Philadelphia, our outreach people make sure they keep going back to the appointments and getting all of the assistance the federal government has for our veterans, because they truly are doing a great job. Well,
once they are connected, though, what types of services are available, and how do you work to ensure that some of those barriers are broken down and these men, you've mentioned that they are men, get the information and the services that they need in order to work to break this cycle of homelessness?
I think the biggest struggle that we have is once we identify a veteran who is homeless, it can take us months, sometimes 6, 7, 8, 9 months to engage that individual to be willing to come with us to go to the Veterans Hospital, do the work that's necessary to get re-engaged in the services. They may need detoxification. 50% of our veterans who are homeless have a significant alcohol and drug problem. All of our veterans who we see have a mental illness, mostly post-traumatic stress disorder is the predominant mental illness. So it keeps them from functioning and doing the things they can do for themselves in order to receive the services. So our outreach is around getting them connected. Once they get connected, they're doing a pretty good job of staying connected, but they have to work to recover.
Thanks so much for being with us. Some important information, and the help is out there. Thanks, Harry.
Thanks for having me.
We've been talking with Harry Marmorstein. I'm Jill Horner.